Hello and welcome. My name is Linus Chirchir. I am a healthcare IT professional from Moi Teaching and Referral Hospital in Eldoret, Kenya. And together with my colleagues Dr. Wilson Arwasa, who is the CEO, and Mr. Stanley Kulei, a planning, monitoring, and evaluation professional, we are happy to present you the findings of our study entitled Determining Role of Social Factors in Adoption of Electronic Health Records by Nurses. Firstly, I would like to outline the contents of our study. We will have a short introduction and motivation, followed by the description of the methodological approach. The main focus, however, will be on the findings. That is the descriptive statistics, correlation, and regression analysis. We will have a brief discussion of findings, draw a conclusion, and make some recommendations. To introduce the topic, we would like to define what an electronic health record is. An electronic health record is a digital version of a patient's paper chart. Electronic health records are official secure documents available on real-time electronically. Adopting an electronic health record has influence for the social transformation in healthcare. These systems have the potential to address the health needs of society and can contribute to health funding as well as policy formulation. What is the motivation of this study? Previous studies have produced mixed results on major predictors of computer attitudes. A number of studies have found age, computer experience, practice site to be the precise predictors, whereas other writings have not. Studies indicate that literacy in computers, training on systems, clinical specialty, profession, and job contentment are some of the variables that relate mutually with attitudes. This study, therefore, looked at how social factors, that is, the technical skills and attitudes towards electronic health records use, affect the adoption of electronic health records by nurses at Moi Teaching and Referral Hospital, MTRH. The methodological approach. Descriptive cross-sectional survey design was adopted for this inquiry. A list of all 926 nurses in MTRH was prepared, and computer randomization program was used to select a proportion of 279 random numbers between 1 and 926. The study proportion target was 1/3 of all the nurses in MTRH. The respondent sample size was arrived at by applying Taro-Yamane's formula. The study used 95% confidence interval and allowed a margin of error of 5%. Quantitative primary data was collected using 5 close-ended questionnaire scale items for social factors and 5 scale items for electronic health records adoption. Response statements were scored with the most favorable dimension given the highest score of 5 and the most unfavorable dimension given the lowest score of 1. On the results, we would like to present you our findings. Research findings reveal that there is management commitment to electronic health records implementation with a mean of 4.17. All the studied factors summed up to a mean of 4.01, standard deviation of 0.63, skewness of negative 0.63, and kurtosis of 0.72. Since the values of skewness were tending to 0, then there was a relatively normal distribution of the responses. All the items in kurtosis ranged from -3 to +3, as shown in Table 1. Correlation analysis. Correlation analysis revealed an affirmative, strong, and statistically meaningful link between social factors and electronic health records adoption, with an R value of 0.591 and a P value of less than 0.01 as shown in Table 2. Regression analysis. Based on a bivariate linear regression model, the inquiry examined the consequence of social factors on electronic health records adoption. The study tested the following hypothesis. Social factors affect electronic health records adoption by nurses at MTRH. From the model summary, the findings reveal that social factors explained 34.9% variation in electronic health records adoption, with the R-square value of 0.349. This implies that 34.9% of these factors could be explained by EHR adoption, as shown in Table 3. Analysis of variance. The results for analysis of variance indicate that the model was statistically significant in linking the social factors and electronic health records adoption with an F-value of 1.48.721 and a p-value of less than 0.01 as shown in Table 4. Considering the value of the F statistic, the alternate hypothesis was therefore accepted. From the regression coefficients, the study findings indicate that social factors positively and significantly predict electronic health records adoption, with the beta values of 0.615, t-value of 12.195, and a p-value of less than 0.01 as shown in Table 5. In the discussion of findings, descriptive analysis showed that nurses agreed there is management commitment to electronic health records implementation in MTRH. That was consistent with an earlier finding, which indicated that senior management backing was incontrovertibly correlated with electronic medical records adoption. Correlational analysis demonstrated a positive, strong, and statistically meaningful link between social factors and electronic health records adoption. Social factors accounted for 59.1% positive relationship with EHR adoption. The findings were in line with earlier studies by Katurura and Cilius, who identified such social factors as critical success in implementation of electronic health records in South Africa's public health care. Linear regression analysis revealed that social factors can statistically and significantly predict electronic health records adoption. This implies that these factors predict a magnitude of 61.5% on electronic health records adoption. These findings were consistent with those of Garafand, Moseni, Asadi, Etemadi, Muradiju, and Musavi, who found that social impact is effective in the uptake of health information systems. In concluding, the findings of the inquiry underscore that social factors do statistically and significantly predict electronic health records adoption at MTRH. The study concludes that training nurses to rely upon electronic health records and their decision support instruments can work to speed up an all-round EHR uptake. It is therefore recommended that nursing schools should incorporate informatics into their curriculum to ensure future nursing students are equipped with skills and the qualifications that can help drive healthcare's application of technologies such as electronic health records. Thank you. Stay safe and healthy.